Hello and welcome everyone. I'm delighted to be here to talk to you all about health misinformation. I am a cognitive psychologist from UCC, and my main research interest would be looking at what people believe, what they remember, and how those beliefs and memories might shape their behavior and their lived experience. So obviously this is really relevant to health and never more so than during the current pandemic. So today, to kind of delve into this research, I'm going to ask you four questions. I'm going to answer those four questions. So the first would be, who falls for misinformation? Then when do we fall for misinformation? What happens next after we fall for misinformation? What does it do? And lastly, how do we reduce the impact of misinformation, which is the question on everyone's minds at the moment. So I'm going to jump right in. And our first question is, who falls for misinformation? And by way of answering this, I'd like you to try and answer this brain teaser question. So in a field, there is a patch of weeds. Every day, the patch doubles in size. If it takes 50 days for the patch to cover the entire field, how long would it take for the patch to cover half the field? Now, if you're like most people, there's this voice in your head that's dying to say the answer is 25 days. That is your gut response, because we see 50, we think half, and 25 seems like the right answer. If you slow down and you reason out this question and you really think about it, you'll see that the answer is actually 49 days is the correct answer there. And so this item is an example of a question from a test called the Cognitive Reflection Test. And it's designed to assess our ability to kind of override an initial intuitive response and go with the kind of correct, more reasoned response. And what we find is that across a number of studies is that people who score better in these tests tend to have reduced susceptibility to fake news and for false memories of fake news. So it seems that our ability to kind of slow down, to overcome this initial gut response is important, as are a number of other cognitive variables. So in some of our other work, we've looked at cognitive ability, which would just be something as simple as your score on a vocabulary test. That's also associated with susceptibility. But we have to consider other kind of contextual factors as well. So another way of looking at this might be to show you a news story from the abortion referendum in Ireland in 2018. You'll see here, this is a story about the No campaign destroying posters because they were bought using funding from pro-life lobbyists from America. And if you're reading this, and if you remember this happening, and if you can remember seeing this in the news, there's a decent chance that you were a yes voter, because we ran a very large-scale study with the journal.ie during the referendum, where people saw either this story presented as a scandal about the No campaign, or the same scandal presented as happening to the Yes campaign. And what we found was that people's false memories and their susceptibility to fake news was more likely to form, these memories were more likely to form along the lines of their pre-existing attitudes. So when you're a yes voter, you're much more susceptible to fake news that makes the No campaign look bad. And this is in line with a lot of cognitive research, and we have replicated this finding in a couple of contexts. So most recently, we have found the same thing in relation to Brexit. So you'll see here an example of a news story where the Vote Leave campaign was accused of election tampering after over 1,000 Remain ballots were found in a skip outside a polling station. Now this didn't happen, this is a fake news story as well, and we presented people either with this story about the Leave campaign or the Remain campaign, and again we see this effect where if you're a Leave supporter, you're more likely to form a false memory that makes the Remain side look bad. And these weren't just passing kind of, oh yeah, that sounds true. People were reporting rich false memories. So you see here an example of someone who said, I think the alleged tampering was over the top. Anyone could have put those votes in the skip. Or someone else on the Remain side saying like, I felt cheated. So what you're seeing here really is that misinformation, in this case, fake political news stories, can distort people's memory of the past and can have quite a significant effect. But it's important for us to note, in terms of answering our first question, when we think of who falls for misinformation, individuals with lower cognitive ability are more susceptible. Those who engage in less analytic thinking, who are more inclined to that kind of reflexive thinking rather than reflective. And also all of us are more vulnerable if the story aligns with our pre-existing beliefs. And these effects are additive, they're not necessarily independent. So, we did find that this attitudinal congruency effect was strengthened when an individual had lower cognitive ability. So these are by no means the only factors that predict susceptibility, but there's some really interesting ones, and obviously they interact with each other as well. So driving on to question 2, when do we fall for misinformation? So here I just want to touch on some research that addresses kind of contextual issues. So if we assume that all of us are susceptible sometimes, what might predict or what might make us more likely in certain circumstances to fall for misinformation, whether that's health or political misinformation or any other kind. So I'll ask you to consider, is this statement true? Are turtles deaf? And what's surprising, and this is a very robust effect, is that if I ask you this statement with a picture of a turtle versus without a picture of a turtle, you're much more likely to think that this is true. And this is called the truthiness effect. And it's simply that when something is presented with an image, even though the image does nothing to help us figure out the veracity of a claim, it helps something to just feel more true. And this has been demonstrated across a number of studies and over a delay period as well. We'd like to think that we all reason kind of independent of things this kind of silly. This is just an image of a turtle. It shouldn't have any bearing on whether or not we're able to work out if something is true. But a lot of the time we are relying on these kind of gut feelings of kind of, yeah, that sounds like it's about true. And just adding a photograph to something, even if the photograph doesn't speak to the claim at all, does increase the likelihood that we will say that it's true. And there are other ways in which something can come to kind of feel true to us, even when it's not. One example of that is illusory truth. So illusory truth is simply the effect whereby the more often you see something, the more it starts to sound true, even if you knew it wasn't very true to begin with. So in a few studies in this context, individuals have been shown news stories like this that at first glance they look at it and they say that's definitely not true. It's not very believable. In this case, a story about Mike Pence undergoing gay conversion therapy. And what I'll show you here is a graph showing that if you see it in yellow, you see the people's truth rating on their first exposure. In blue is how they rated it the second time, and in red, the third time. And so what you see is that each time they're exposed to it, it comes to sound a little bit more true. It just starts to feel kind of right to them. And you'll see there on the bottom, in one case they used a warning, and the other condition, individuals were given no warning, and it didn't matter. The warning didn't stop this effect from happening. And we'll circle back to warnings in a while. So the more often we see something, the more it starts to feel true to us as well. And so in some of our own recent work, we've been looking at illusory truth effects in kind of different contexts. So one of the things we were interested in was sort of rumors and sort of hearing something and answering hypothetical questions. Does that lead to an illusory truth effect? So what we did was during the last general election, we asked people some hypothetical questions, and one of them was written like this. So would you be more or less supportive of Fine Gael if you heard that since becoming Taoiseach, Leo Varadkar has donated 25% of his annual salary to charity? And this was just asked as a, how would you feel, like a typical polling question alongside some other neutral questions. And some people saw this question, some saw negative questions. There was a mix of conditions. And what we were interested in was we followed people up then either a few hours or a few days later, and we showed them a range of news stories to do, in this case with Fine Gael. We did this with a number of public figures. And in and amongst the true stories were some fake stories. And one of the fake stories was a kind of perfect match to the hypothetical question. So if you can see this one here, Leo Varadkar was praised when it was revealed that he has donated 25% of his annual salary to the ISPCC. And this was phrased as a news story. It said, do you remember this happening from 2017? What we found was that initially there was kind of a low level of believability. The story wasn't seen as all that plausible. It didn't happen. So people generally didn't think it was true. But if people had encountered this question, particularly if there'd been a delay and since they had encountered this question, people were 3 times more likely to falsely remember that this had happened. And so here you see that, kind of small encounters that we have with certain pieces of information can all just add to this feeling that something feels true. And the most concerning part with this study was that participants had no idea. So we asked them, we said, okay, you said that you remember this story happened, you've seen it in the news. Where did you see it? And they were listing sources. They said, I've seen it on RTE, my wife told me. People were telling us detailed accounts of where they had seen this in the real world. completely unaware that actually it had just been kind of planted in their minds from our study. And so in terms of assessing kind of that second question that I asked, in terms of asking ourselves, when are we most susceptible to fake news, to misinformation of any kind related to health or politics or any other topic? And we know that we're more susceptible when the story is accompanied by media. It's just more convincing. And also if we encounter the story multiple times in whatever format that might be. So our next question is, what happens when we fall for misinformation? So say someone comes to believe something is true, or they form a false memory that an event really happened. What happens next? If you have read any media over the past few months or few years, you'll know that fake news has been blamed for all kinds of outcomes, like Brexit, Trump. The WHO recently has expressed a lot of concern about the infodemic that has come alongside the COVID-19 pandemic. And so you might assume fairly that we probably have loads of research on what fake news actually does, how it might change people's behavior, maybe how exposure to fake news related to a vaccine might make people less likely to actually go and get a vaccine. But surprisingly, we have almost no research on the downstream effects of fake news. And most studies, including many of my own, we've been measuring, do people believe it? Do they remember it? Are they willing to share the news? We don't tend to try to test these downstream effects. And obviously it's difficult to test the impacts that news might have on behavior, but it's a really important question. And it's a question that we should be somewhat critical of, because I'm sure many of you watching here are health researchers who try valiantly to change people's health behaviors all the time. You put a lot of effort into trying to change behavior, and you'll know that it's difficult to get significant or sustained changes in behavior, even when we throw the kitchen sink at someone with an intervention. So the idea that people would encounter a single fake news story and this will change how they vote or their health behaviors, it deserves some kind of critical interpretation. So in a recent study over the summer, myself and my colleague Kira Green from UCD, we ran this large-scale study with the journal.ie, where we presented people with some true stories and some fake stories to do with COVID-19. This is an example of one of the fake stories here, where we said that the programming team who designed the HSE app, it hadn't been launched at the time, to support the coronavirus contact tracing were found to have previously worked with Cambridge Analytica, raising concerns about data privacy. Now, this isn't true, and we were interested to see whether people would believe it and remember it, which they did, but we were more interested to see, would this lead to changes in people's reported health behaviours? So in this case, their willingness to download the contact tracing app. And what you'll see in these graphs, I hope you can see, is that the effects were very, very small. So what you'll see here on the left is the graph showing those who viewed the story with those who didn't view the story. And you'll see those who viewed the story on the left were slightly less willing to download the contact tracing app. On the right, there's a graph comparing those who remembered that this story happened in real life versus those who didn't. And you'll see again, kind of, they were slightly less likely to be willing to download the contact tracing app. And this was a very large study of over 4,000 people. We were really well powered to detect kind of small effects. And what we found, because we tested multiple different health behaviors, multiple different fake stories, we found inconsistent effects. So not every story had any impact on behavioral intentions. And when they did have an effect, it was like this, it was very small. Now, obviously, this was a single exposure in the context of a study. There's all kinds of other factors that would come into play in real life. But we think this is a really important first step to trying to just quantify what is it that fake news does, because only by quantifying that harm can we hope to design an intervention to combat it. So certainly we think there's a lot more research needed in this regard, and if any of you are interested in collaborating on this, we'd love to hear from you. We think we need a lot more data on how exactly what these downstream effects of misinformation actually are in the context of health. So my last question then was, how do we reduce the spread and the impact of misinformation? And there are multiple approaches to this. Lots of you will be familiar with various kind of fact-checking organizations like Snopes or the journal.ie do this as well. And fact-checking is really important, and it certainly has an important role, but it doesn't necessarily help to reduce belief or sharing of misinformation. So Facebook a couple of years ago attempted to run an intervention where when people shared a story that they, other sites had found to be fake, they gave people a little warning, and they hoped that this would reduce people's sharing of misinformation. But in a lot of cases, it actually just made it worse. It strengthened people's beliefs in it, and it had a lot of unintended consequences. And this story kind of underlines how important it is that we actually go and test these interventions, and a lot of these effects in this area that seem very intuitive and we think make absolute sense don't really work. And so another example of this would be warnings, just general warnings. So not attaching a warning to a specific study, but just generally kind of raising awareness, encouraging people to look out for fake news. You see a lot of these campaigns. I'm sure most of you have seen one before. And on the HSC website at the moment, there's a whole section on kind of how to approach sources and how to find reliable information during the pandemic. And we might think that this would work, but again, we have almost no evidence on it. So very little research testing these general warnings, seeing does it reduce people's susceptibility. So as part of that study that I mentioned with the journal.ie, we tested this approach, and it kind of follows an inoculation metaphor whereby we think we'll warn everyone about fake news and then afterwards they'll do better, they won't be so susceptible. So we expose people to, we just asked them to look at a couple of public health posters. So this is an example of one of the control posters to do with washing your hands. And we asked people, how many times have you seen this in the last week? So we just wanted them to read them and interact with them like they normally would. And some of the posters they saw were related to fake news. These, very similar to these kind of public information campaigns. And we tried versions that were worded kind of positively. We tried ones that were framed more negatively. And then we had a series of control groups as well. And to cut a long story short, the warnings did nothing. They had no effect on fake news belief, no effect on false memories, and no effect on the related behavioral intentions. So reading a warning about fake news didn't stop that reduction in willingness to download the contact tracing app if they saw the story about the contact tracing app. And this is perhaps not all that surprising that these warnings don't work, because if you cast your mind back to the start of my talk where I mentioned that problem about the weeds and the difference between reflexive and reflective thinking, most of that research would suggest that we are capable, most of us, of discerning a lot of the time between reliable and unreliable information if we really try. But most of the time when we're consuming information online, like if I'm a patient and I'm looking up information about my health condition, I'm not going into it thinking, is this accurate or is it not accurate? I'm going into it with other questions. I might have kind of emotional needs, or it might be, I might be in a social kind of frame of mind if I'm in a support group. I'm not going into it thinking that my job is to evaluate accuracy. But the idea is that if we could encourage people to do that, if we could nudge them into a frame of mind where they are thinking about accuracy, they might be actually able to do it. There's a couple of studies that have shown some promise with this. So in the study here, people were either asked before they viewed some news, they were asked, is this story accurate? Just asked to make an accuracy evaluation, or they were asked, would you share this news story? And what they found, as you can see here, the y-axis here shows people's willingness to share a story. When people underwent this accuracy intervention, when they were nudged to think about accuracy before they viewed information, they became less willing to share any fake information, and it didn't impact their sharing of true information. So this is one of kind of a couple of promising intervention methods that suggest that maybe if we look at kind of these evidence-based solutions to encouraging people to apply the abilities that they already have, we might be able to better combat misinformation. Because, another thing I didn't mention there is that fact checkers can't keep up. It's much quicker for me to create a fake news story and share it everywhere if I'm a bad actor than it is for a fact checker to have to combat that. So, it's more economical too if we can empower patients and members of the public to just be better able to discern true from fake information, and kind of encourage them to apply that skill kind of by nudging them in that regard. So in summary, misinformation is powerful. It can distort our memories. We need a lot more research into the downstream effects of misinformation, and some of that research is ongoing. Susceptibility to misinformation can be increased due to individual differences and also due to some situational factors. And finally, we do need to develop solutions to target cognitive skills rather than relying on fact checking. So we are undergoing some research in that regard at the moment, some of which is funded by the HRB, and we're really excited to see what we might find in that regard, but very open to collaboration. So I'd love to hear from some of you if you want to get in touch about following up on this a little bit more. Final thanks to all my co-authors, especially Ciara Green from UCD. We do a lot of research on this together, so most of these studies were done with the two of us, and also to the journal.ie, who have been a wonderful partner in assessing these kind of evidence-based solutions, and we're really glad to work with them. So I'm happy to take any questions or get in touch via email.